The third time is the charm, and third time that we're going to be in Dr. Phillip Denney's office here in Lake Forest, California. You know, we've been having some wonderful conversation on the past two shows with Dr. Denney, and we're going to continue our conversation today. All kinds of interesting. Last time we talked about marijuana and addiction, and marijuana being mellow, and marijuana and hypertension. We got a few more questions I'd like to talk to you about in regards to the medicinal use of marijuana. Dr. Denney, if you haven't seen our show before, specializes in cannabis-based medicine, correct?
Yes, that's right.
And you know, I meant to ask, I notice you always use the word cannabis instead of marijuana.
Always.
How come?
Marijuana is a slang word.
Right.
Marijuana is a Mexican slang word, and most people know where it came from. There's a famous song that every child in the Western Hemisphere knows called La Cucaracha. La Cucaracha, La Cucaracha, you know the song. Everybody knows it. The second stanza of that song has a line in it that says, "We the cockroaches won't march without our marijuana."
Yeah.
And the cockroaches were Pancho Villa's foot soldiers, and they called themselves that as a kind of a slang derogatory term, and that's where the word marijuana came from. The proper word is cannabis. This is the technical scientific word, and I think given the politics of what we have to deal with, Lanny, I think we're all much better if we separate the two as far as we can. The legal use of cannabis and the illegal use of cannabis. So I'm very careful. I don't call it weed, I don't call it dope, I don't call it smoke. That's what illegal patients use, people who are using it to get high and to party. What we're talking about here is the medical use of cannabis, and when we talk about it in those terms, I much prefer the proper word.
But the law keeps using the word marijuana.
They're wrong.
Oh, I know. I can't argue that. I can't. But you know, I have this thing, and when we're talking with police especially, and we say the word cannabis, they'll turn around to the audience and say, "We're not talking about cannabis. We're talking about marijuana." And everybody says, "Oh, you know," and.
But again, you have to understand where they're coming from. These are the same people that call marijuana a narcotic.
Oh yeah,
And clearly, by any measure, this is not a narcotic.
Okay, why isn't marijuana a narcotic?
Because it's not derived from the opium poppy. All things that are narcotics are medicines that are derived from the opium poppy. Unfortunately, we have this dichotomy because law enforcement calls narcotic anything that's illegal. So methamphetamine is a narcotic in their lexicon. Vicodin, if it's illegal, is a narcotic, of course. Marijuana is a narcotic, et cetera, et cetera.
Yeah.
So again, I think that we have to be very careful about what words we use.
It's interesting. So methamphetamines are not a narcotic.
No,
because
they're stimulants.
They're stimulants.
Right.
Okay.
We have to be very careful here because the people who are opposed to this are not very sophisticated from a scientific point of view. And unfortunately, the people who serve on juries are not very sophisticated about science either. So they get away, I think, with a lot of stuff that is not exactly accurate.
Well, when I'm in your presence, Doctor, I will use cannabis.
Thank you. That was
so. There you go.
That's good.
And so, talking about cannabis, one of the things that's come out recently is the use of cannabis for depression. And there was a study that just came out of USC that's saying that people who smoke or utilize marijuana are less likely to be depressed than people who don't, just in the general population. Have you found that to be true?
Well, I think that's very true. I think that cannabis is an extremely effective treatment for depression because it's a great mood elevator. Now, is it magic? No, it's not magic. Is it going to bring somebody out of the depths of a bad depression immediately? No. And in many cases, as with other conditions, it serves as an adjunctive medicine, meaning that it doesn't completely substitute for the standard things, but often improves the quality of the outcome if the two are used together. And I think that's particularly true for the psychiatric conditions. The psychiatric medicines that we have available to us today, while in many cases are quite effective, are often very difficult to tolerate. And so I think cannabis has a great role to play in many of these things, not just depression, but in many of the psychiatric conditions. I think bipolar affective disorder, for example, is a very appropriate diagnosis for cannabis use. Tourette Syndrome, for example, another very unusual kind of thing, but seems to respond quite well. There's a whole variety of personality disorders that seems to respond well. And I could go through a lot of others also.
Well, last semester as a nursing student, I was in a psychiatric hospital and dealing with a lot of the psychiatric patients. In some cases, I thought, wow, some cannabis would really be beneficial to help calm them down and this kind of stuff. And yet, of course, everybody who worked there took a very negative view of at least officially, view of cannabis. I couldn't help but think some of them would benefit enormously by it.
Well, the fact of the matter is, Lanny, as you well know, cannabis has been used by human beings as medicine for probably 10,000 years or more. So none of this is new. Mm-hmm. We have known as physicians about the benefits of cannabis for hundreds of years. And again, part of the political difficulties that we have here is that we're very willing to give up our collective experience for political correctness. And I think that's a problem. Although I have to tell you, it's changing. It's changing dramatically. The fact that now it's the 10th anniversary of this law in California, we now have somewhere around 300,000 Californians who use cannabis as medicine, in addition to the other 3 million or so who use cannabis recreationally. My question is, where's the problem? I don't see it. I certainly see the problem with alcohol. See the problem with tobacco. I certainly see the problem with methamphetamine. Where's the problem with cannabis?
Well, that's what we find interesting. It's happening in the Riverside County, especially with the dispensaries have opened up. The police have said for so long that if you open up these, if cannabis becomes available, it's going to, just all hell's going to break loose. And there's these dispensaries opened up, and then there was one of the cities wanted to regulate them. And so the newspaper went to the president of the Business Owners Association where the dispensary is located and say, what do you think about this dispensary located here? What kind of problems does it cause? And the guy says, well, until I read about it yesterday in the newspaper, I didn't even know it existed. and what the politicians are hearing and people are hearing, there isn't a problem.
Yes.
And the fact is, it doesn't cause problems, it creates benefits for society.
Well, I certainly would agree with that, Lenny.
Well, thank you very much, Doctor, for joining us here on Marijuana Compassion Common Sense. If anybody would like you welcome people calling you for...
Oh, yes.
So, Dr. Phillip Denney, Lake Forest, California. Give us a call at our phone number, 799-2055, and we'll give you the information how you can contact Dr. Denney and learn more about medicinal marijuana.